September team brief comes from the Estates Department here at Buckingham Row, and I'm shortly going to be meeting one of the Trust's most well-known faces, David Evans. Now, how much do you know about estates? How many square metres do our buildings cover? How many meals a year do we serve? How much electricity do we use? And finally, which member of the estates team plays bass guitar in a rock band? The corporate objective for this month is about staff engagement. And of course, last year we had the hugely successful Listening into Action scheme. Now, what we want to do this year is bring all of our programmes of engagement together. So there's the good work that we've always done on SID, there's the project we're working with Unipart, and together with Listening into Action, we want to have that as a common process with champions for each of them. So we'll be taking a board paper later on this year describing how staff engagement becomes a single integrated programme. For the headline safety measures, I'm pleased to be able to bring you some of the best figures I've ever reported in a monthly set of figures. So in July we had no cases of MRSA, none of C. diff, just one MSSA and one E. coli. We also had 2 more months HSMR data, which is 87.5 for May and 84.5 for June, taking our average for the year to date to 82.9. Now, I just need one word of warning that these figures are about to undergo their annual rebasing, so they will be higher next month. But look at the chart here for C. diff. The first 3 months of the year we are well above our control target, but you can see the effect of having 1 month with no cases, so we need to keep that up. And here on the mortality chart, you can see these really excellent last 3 months at the low 80s, very fine achievement. And putting this all together, it means we've had one of the best months ever for serious harms. So in the month of July, there were 2 serious infections and 2 serious falls, but no never events, no pressure ulcers, no ventilator-acquired pneumonia, and no central line infections. So that's a total of 4 compared to 13 in the previous month. Our headline target of effectiveness is the A&E department, and you can see from this chart here that we are still in mid-table but closing inexorably on Salford in 3rd place. So I'm sure we will see us rising up that league table soon. July was not a good month for finances, as we moved from being in surplus into a deficit, which is now up to £200,000 for the year to date. And although income was nearly £1 million above budget, unfortunately expenditure was nearly £2 million above budget. Our CIP though is on track so far this year, as is our capital expenditure with 7.6 million. So our financial risk rating remains a satisfactory 3. Some of the main infrastructure developments to report around the Trust. First of all, at South Ward, where demolition is now in progress because we've been able to remove the last of the asbestos, and this is in preparation for the start next month of building the new oncology suite, which will be a fantastic development. We've also agreed how we're going to build the new Wrightington access road for when the works commence later on next year. On IM&T, we've just started on the new Paperlight project, which has been launched, and the aim of that is to minimise the use of paper within the organisation over a period of about 3 years. And I am in a position to announce the latest MAS scheme, where applications will be closing on the 13th of September, so you need to act quickly on this one. The details are on the website, but just to remind you, there isn't really much point in applying for this if you work in one of the areas that we've recently expanded, for example, nursing levels on the wards. But discuss with your manager if you're interested in applying for the MAS scheme. I'd like to update you now on the position on Healthier Together, although there aren't any concrete developments to report, and the programme continues to work towards a possible consultation later on in the year. However, what I would like to share you with is the Trust's increasing opposition to the model that's being proposed, with the possibility of trusts like Wigan losing emergency surgery. We simply don't believe that that's going to be in the best interests of our patients locally, and I'll be telling you more about this at next month's team brief. Now something really important for those of you who still smoke, because the Trust is going to be joining in with the campaign run by Public Health England called Stoptober. So this is about stopping smoking during the month of October, and the objective is to get you to quit for 28 days, because the evidence is if you stop for 28 days, you stay stopped. Now we're going to be working with Bridgewater and Public Health England, But our main focus is going to be on something that you complain to me about more than anything else, and that's about staff and patients smoking outside the front entrance to our hospitals. Now, we're going to be having a big campaign to stop you doing this. So if you are one, or if you know somebody who is, please make sure that in October their life will be uncomfortable if they continue to smoke outside the front entrance to the hospital. And finally, it gives me great pleasure to announce that the Employee of the Month for July is Andrea Arkwright, our Head of Engagement. Andrea is somebody that's worked for the Trust for many years, is extremely well known, and in particular recently she led the campaign to get the Friends and Family Test introduced into the Trust, and you will know that this Trust did extremely well compared to others. So congratulations to Andrea, and that's the end of this month's Team Brief. Here I am now with David Evans, the Associate Director of Estates and Facilities, whom many of you will know because David is one of the longest serving employees at the Trust, having been with us over 33 years. So David, what are the main functions of Estates and Facilities?
The main function of Estates and Facilities is to create and maintain the buildings that the Trust owns. In addition, we also provide a wide range of non-clinical support services such as catering, domestics, portering, transport and day-to-day maintenance.
I see. And what's new in Estates and Facilities?
We're currently working with the Carbon Energy Fund around the provision of combined heat and power units at both Royal Albert and Leigh Infirmary. These will be really beneficial in terms of reducing the electrical consumption and also providing a reduction in our CO2 emissions as we go forward.
And what are you most proud of in your department?
Without doubt, it's the fantastic team of highly dedicated people that work within the division. In addition, I'm very proud of the progress that we've made over the service and site development programme over what is a very short space of time.
What are the main problems and pressures that you face?
Undoubtedly, trying to improve the quality of the environment and reduce healthcare acquired infections, whilst at the same time trying to reduce the costs to the lowest level possible.
Do you have any personal good news stories to tell?
Certainly do. The Hanover development over at Leigh, which we're extremely proud of, has been nominated for the Building Better Healthcare Awards in the Use of Existing Estate category. In addition to that, the producers of the James Martin Hospital Food Programme recently contacted the Trust to ask if we'd be interested in taking part. They sent a production team along and spent a full day with our catering team and came to the conclusion that there was actually nothing they could teach us about hospital catering and decided not to come to Wigan. We're very pleased about that.
And that reminds me, you were telling me about how we've got a grant recently to put charging points on each of our sites for electric vehicles. So that's another story too, isn't it? Is there anything else you'd like to include?
Finally, I'd like to say that the Trust is supporting the Public Health Stoptober campaign, which is all about encouraging staff to give up smoking during October. And over the next few days, we'll be putting out a whole load of publicity around what's going to be happening at that period of time and how we can encourage our staff to stop smoking. And
finally, the quiz questions. So, how many square metres does our estate cover?
Actually, it is 119,866 square metres, which is the equivalent of about 1,500 three-bedroom properties.
And how many meals a year do we serve?
Over the course of the year, our staff kitchens will produce 959,000 meals.
How much electricity does the Trust consume?
Last year, we used 14.7 million kilowatt hours at a cost of around about £1.5 million.
And finally, who's the member of your department that plays bass guitar in a rock band?
Marcus Summers, who's the Head of Operational Estates, and the band is called The Secret People.